really are living in a chronic disease epidemic right now, and it used to be that people were dying of infectious diseases and things like that. Well, now we're finding that autoimmune diseases are so epidemic. 1 in 10 adults over the age of 65 are going to be diagnosed with dementia. I think it's 1 in 4 children as of now will obtain a diagnosis of depression. 1 in 68 kids is on the autism spectrum disorder, and 1 in 6 kids has a developmental disorder of some sort. So this really begs the question, what is it that has led to all of this chronic disease? And genetics is a piece of the puzzle, and when we did the Human Genome Project, we really thought that we were going to kind of unlock all the keys to everything, and we discovered after that was over that there are so many pieces of the puzzle still remaining. So what we are discovering now, what integrative practitioners and functional medicine practitioners are discovering now, is that it's really our environment that's the biggest piece of the puzzle. So our environment is bathing or washing over our genes. We're born with a certain set of, we're born with a code, which is our genes, and that code is not fixed. So depending on where you live and how you breathe and how you relax and what you eat and what toxins you might predispose yourself to, your genes will express themselves in very, very different ways. And they've shown this over and over again with in twin studies. So functional medicine is really this beautiful, beautiful framework. It's a new map. It's a new GPS system for us to really be able to look at a patient and say, what were the more upstream causes, root causes of your illness or your developing pathology, rather than waiting until you've gotten downstream to, like Dr. Rowin was saying, to the point where you're so inflamed and your antibody levels are high and you have a high disease burden. This is what our traditional allopathic conventional medical colleagues typically do, and it's no fault of their own, because both her and I went through the same experience in medical school. We weren't given this framework, unfortunately, and I think the landscape of medicine really is changing so that in the future, functional medicine will become more of a norm. And we're trying to get the word out now, because this is really, really the best framework to be able to treat all chronic disease, because like I said, our conventional colleagues, they're working in a broken system. They're working in a system that's intended for acute care, and they're using acute care models to treat chronic disease, and it just doesn't work that way. So functional medicine is a wonderful way to treat chronic pain, like we see here at APAC, because chronic pain is a component of so many diseases. And really the underpinnings and the root causes of almost all diseases these days is chronic inflammation, misguided information in terms of how your genes are expressed, and oxidative stress. So, chronic pain costs us over $650 billion a year annually in terms of medical costs and lost productivity and lost wages. And really, it's kind of the biggest epidemic. And like I said, it's a component of so many other disorders or problems that people face. So like fibromyalgia, for example, somebody may have insomnia, fatigue, as well as pain, as well as digestive problems. So functional medicine can treat them so beautifully. Same thing with headaches, chronic headaches. People with chronic headaches have problems sleeping, have problems with their digestion oftentimes, and problems with toxicity issues. So functional medicine is really this, I'm saying it over and over again, but a beautiful framework to be able to address these patients and treat them ideally.